The Development Bank of Namibia really places employee wellness holistically, including mental health, as a strategic priority. Most recently, we concluded our 5-year business strategy for the bank, and holistic wellness is such a key focus in that strategy. And so, and that really stems from the fact that we at the Development Bank primarily believe and acknowledge that employees are people first. And supporting the well-being and especially the mental aspect of it is really essential to their personal and professional success, and obviously that of the bank as well.
So how does the DBN assist in the case of an employee that is affected by mental health?
So I think the first point of departure is really for us as a human capital team, it's twofold. And the one is really for us to understand the data, to really understand to what extent is mental health, a challenge within the employment workspace, and what are the dynamics at play, what are the triggers, what are sort of the high-level themes that informs that view, and then sort of going on to develop much more targeted interventions that support mental health, and I will delve into that just a little bit. And one of the things that we have done also this year is really to revise our employee health and wellness policy to adapt and to ensure that we really bring in the key concepts. As we all know that, health is really sort of getting diversified, whereas in previous years, you would really see that the wellness wheel only comprises of 4 elements, and now we see that it's expanding more and more, of which mental health is quite critical. So, and some of the support that we offer to our employees, and we look at it from twofold: how do we create balance, but also how do we create sustainability in the people practices in terms of supporting mental health. And it's really around provision of psychosocial support in the form of counseling, where employees can have access to a psychologist, to a coach, as well as to a psychiatrist, depending on the severity of mental health. We are also looking to specifically this month really ramp up on internal awareness campaigns, because we believe that an informed employee is an empowered employee, and they can really own and take ownership of their mental state, but obviously through the provision of some of these services from the Development Bank, and also really ensuring that our employee engagement initiatives also open up dialogue to some of these otherwise sensitive matters, if we may call it, if we look at it from the lens of just the stigmatization and the discrimination at times that comes with people not really understanding what mental health really is and where it comes from. And empowerment also comes with training for leaders, because we also believe that leaders are really the champions of holistic employee well-being. I mean, they are the first point of contact to identify when team members are not okay. And I think that's the one thing that we also really would like to entrench, is really the idea of, number one, self-awareness, being aware of self and when you're off balance. And then the second thing is really also being observant, being curious, and also seeing and observing when colleagues are not themselves, and really taking it upon yourself to either offer support in the form of directing them to our wellness practitioner in-house, or just having a conversation to identify maybe they're already receiving support elsewhere. But it's really the elements of, number one, being self-aware in terms of empowering our employees, also supporting our leaders through training, as well as also creating a sensitive environment that peers, employees as colleagues, that we can really look out for each other and support one another in a proactive manner when it comes to mental health.
Well, Sara, experiencing stress is obviously part and parcel of everyday life, but how does one differentiate, or how does one know that they have a mental health issue and that it's not just stress at the workplace?
Yeah, and thank you, Milcah, for that question. And I also want to put a disclaimer out there that I'm not at all a mental health expert, But I think from experience and what we have seen is that the differentiator is really the prolongedness of experiencing, negative emotions, anxiety, irritability, the prolonged experience of stress and burnout, where we see sometimes that employees withdraw from work or from social interactions with others. Also difficulty concentrating, which also obviously impacts sleep, appetite, etc. So what we've really seen is how prolonged some of these symptoms are, is what sort of pushes it from the bucket of just experiencing and trying to deal with the day-to-day stresses of life versus coming into a space where it's so prolonged that the individual does not have the tools and the capacity within them at the time. That is now pre-coaching, counseling, and also seeing a professional, is that at the time it's very prolonged, and they actually at that time are out of their depth. They do not have the tools to deal with the mental state that they find themselves in. And it's really about empowering, once again, people to identify that earlier on, that it does not draw on for too long in a way that it puts the employee in quite a severe mental health challenge.
Right. So is there a way to tell that someone is suffering from mental health, and perhaps just how can families, friends, colleagues perhaps help someone that they see has mental health problems?
I think that there's obviously a way in terms of some of the indicators that I've mentioned. Somebody that just seems to be, for quite a prolonged period of time, quite in a negative space of emotions, feeling quite irritable, withdrawn, really uninterested in normal day-to-day activities. And I think also, the people, the loved ones, the community, the support system, the ecosystem in which the individual exists is quite important, because we know and we can tell when somebody is off balance. But it's also quite tricky, because sometimes you cannot tell that somebody is going through a lot. So the key is really for us as a support system, whether as an employer, as a family, as a community, is for us to make sure that, once again, that we are very observant, we're very sensitive in terms of making sure that we create a space for open dialogue and a safe space for people to really express themselves in a way that is non-judgmental and that does not cause stigma, as well as the sense of discrimination. Yeah.
Well, perhaps just in closing, Sara, when is it that a person should visit a psychiatrist or a psychologist? Because, is it because there is a difference between the two, and often some people don't know which one they should consult, especially when a person is going through mental health issues.
That's very true. That's also something that I can definitely confirm with the experience that I've had in terms of dealing with people and employees. And I think in really distinguishing what the right source of support and help is, I just want to make a differentiation between the three of one, which is counselors generally provide guidance on managing day-to-day life challenges, and they also really focus at times on some quite shorter term concerns. Whereas if you look at your area of psychology, that focus is more around therapy and behavioral interventions, but there is no prescriptive of medication when it comes to that. And then your psychiatrist is really the bucket that deals with your much more severe mental health challenges and disorders. And these are really professional medical doctors that can diagnose mental health disorders and also prescribe medication. So the really it's all these practitioners operate on quite a broad spectrum of severity of mental health disorders, and one would need sort of an earlier briefing to determine the nature and the severity of the mental health challenge that they face in order to really say this is where the targeted intervention will really meet the needs of that individual at that point in time.
Right. So just in closing, Sara, how should people, mark the month of October, which is World Mental Health Month?
I think from my perspective, Milcah, is that the encouragement that I would like to give to the public and to the dear listeners is really that a lot of times we look to the system in terms of the employer, the community, the country, to shift some of these key narratives, especially mental health. And fundamentally, I think it is a correct expectation for us to have. I think the opportunity, though, is really for us as individuals to start where we are. Become more self-aware, become more observant, become more present and in tune with what's happening inside of you and also what's happening outside of you if you look at other people that are around you. And it's really for us to start taking notice when things seem to be off balance and seek the appropriate and necessary information. You can never be overly informed. And if you are informed, you are able to either seek for help and reach out while it's early, or you can also use that information to support others that may be going through that. So my message is really, let's take ownership. Let's all advocate and champion for mental health. I believe that in doing it that way, we will really, really shift the needle when it comes to early detection as well as the proactive provision of support when it comes to mental health within Namibia as a country. I think it needs to start with us as individuals, while the system then creates that environment and the resources for us to then eventually get that help and support. But in order for it to be sustainable, it needs to start with us, and we need to own it and really create that environment for ourselves and others to be safe. And to be free to table these matters in a way that resolution, early detection can be found and that people can really be supported in order for us to have a functional and optimal society and employment workplaces as well as homes within our country.